Hi, so about vulvar carcinoma, FIGO staging. So this is the vulva, this is the urethra, and this is the anus, this is the perineum. So, stage one is carcinoma of the vulva, which is confined to the vulva, or it has gone to the perineum. So vulva or to the perineum. Now stage 1 is divided into A and B. A is tumor less than 2 centimeter and B is tumor more than 2 centimeters. Or we can also take a stromal invasion. Here its stromal invasion is less than 1 millimeter. Here stromal invasion is more than 1 millimeter. If it's confined to the vulva, it is 1A. If it has gone a little bit to the perineum, if it's perineum, then it is 1B. Or if the size is more than 2 centimeters, or with stromal invasion more than 1 mm, but confined to the vulva or perineum, this is 1A and 1B. Now, about 2. What is stage 2? Stage 2 is extension to the adjacent perineal structures. So, the next thing for this is urethra, right? So, urethra, the lower 1/3 of the urethra is involved here, and a lower 1/3 of the vagina. So, urethra lower 1/3, vagina lower 1/3 is involved, or anus is involved. So, all of these is stage 2. Now, these all these three lower 1/3 vagina, urethra, and anus is stage 2. Now, what is stage 3? Stage 3 is basically lymph nodes involvement. So, stage 3 is basically lymph node involvement. We know that it drains to inguinal lymph nodes. So, lymph node involvement. So, stage 3 is divided into A, B, and C. So, A is lymph node metastasis. We have a lymph node metastasis, but the lymph nodes are 1 to 2 in number, and the size is more than 5 mm. That will be 3A. Now, what is 3B is at least here the size is of more than 5. Is for at least one lymph node should be size more than 5 mm. Okay, and what is stage 3B? Stage 3B is lymph node 3 or more or in 3 or more are involved, 3 or more inguinal lymph nodes are involved, or 2 or more should be more than 5 mm. In this, one lymph node should be more than 5 mm. Here, two lymph nodes should be more than 5 mm. Okay, now what is 3C? 3C is the same lymph nodes having extracapsular extension. The same lymph nodes having extracapsular extension. Okay, now what is 4A? 4A is tumor involving the upper urethra, upper vaginal mucosa, bladder mucosa, rectal mucosa, and the tumor is, or sometimes the tumor is fixed to the pelvic bone, or if the lymph node is ulcerated, if the inguinofemoral node is fixed or ulcerated. Okay, these are all stage 4A. Now, what is stage 4B? Stage 4B is involvement of these pelvic lymph nodes. This common iliac, external, internal iliac. All of these pelvic lymph nodes are involved. Then it will be 4B. Or any other distant mets.